Wants to know about allulose.
All right. Hey, let's do this before we start. So I have YouTube working, but comment in the chat and let us know what sweeteners you use. I'd be
Yeah.
curious to know. Or if you're a straight up sugar person, maybe you are. Maybe you are. So we'll talk through some of that. Yeah, post those in the chat, YouTubers. You can post those in the comments as well. We'd love to hear from you. Here we go. Just a reminder, Dr. Saunders is a wonderful medical doctor, but he is not your doctor. So we just ask that you consult with your healthcare provider before you implement any of the things that we are talking about today, okay? Because he doesn't know your story specifically. And boy, the more we have these talks, the more we learn, the more we're finding out everyone is just a little bit different.
Mm.
So we want to make sure that we take care of you well. All right.
Looks like we have Joe Barton in the house. Hello,
Mr.
Joe.
Barton.
Hello, everyone. Hello, hello.
Well, technically in the car.
Yeah, in the house. Yeah,
Yes,
not in the car.
All right. Okay, so we're
I
getting,
am
oh, go ahead.
here.
Did we lose him?
Yes, looks like he froze.
Okay.
Oh no, he's back.
It's kind of there, kind of back. Okay, so I thought I saw some comments coming in, but I maybe did not. Let's see. Where is my chat? There we go. Yeah, someone had asked about monk fruit, allulose, stevia, monk fruit. What else are you guys using? I don't use any sweeteners or sugar, but I do at times make an alcoholic drink with Diet Coke, but I'm not a heavy drinker at all. This also reminds me, honey. I have a lot of people that ask about
Yeah.
honey.
Mhm.
Um, I was at a local store yesterday and we were just talking about, they had regular honey and then another kind of honey that they usually carry is creamed honey.
Mm,
And oof, that's good stuff.
I love
That's
cream
real good
honey.
stuff. Okay. Yeah. Jody says, hi, Jody. She says honey as well.
Yeah.
Okay, let's dig into this. So, boy, lots and lots of sweeteners. I want to break down maybe some sweeteners as far as different things that we might be trying to do in our body. So, if you've been around the webinar for a while, you know that Dr. Saunders will talk about using or not using sweeteners if you're someone who is trying to get your blood sugar numbers in check. So, I want to dig into that a little bit. And then I also want to know, Dr. Saunders, what about people who have regular blood sugar? You know, what do you think about sweeteners in their case? So let's dig in to those with blood sugar issues first. Tell us what your thoughts are about sweeteners. And what is a
Okay.
sweetener?
Okay. Sweet is so satisfying to human beings, but not just to human beings, to every animal. So sweet is the thing, is a desired taste. Salty is also a desired taste. So and often, if you remember when they changed in the 1980s, and all of you are going to remember this, way before your time. They changed the formulas for like Coca-Cola and Pepsi, where they added more salt into it so that they could add more sugar and it wouldn't be so saccharine sweet. Saccharine sweet is like a thin sweet taste that it doesn't have the full rich sweetness when you add salt to it. So this salt sugar mixture makes it really good. Now, you want to make it really good, you add fat into it. So, you put butter in there and it's like you get this, let's see, a Danish pastry that's really well done, or some French pastries that are really well done. They've got just the right amount of sweet, the right amount of salt, and the right amount of fat. And it just makes them just wonderful, right? Okay, so sweet is a big part of what makes life good, right? At least things taste good. So the world tastes good. And there's all kinds of songs about that. And we use the word sweet when we think of, I want to talk about my wife. She's so sweet. Um, and my children, they're just sweet. The sweetness is always considered a good thing, right? Well, those of you who have diabetes, I'm going to tell you, sweet is not a good thing. It's not good. Okay, I'm going to tell you a story. I'm going to tell you a story about a bear. So this bear wakes up from a long nap. It's been fasting, sleeping for 6 months. And during 6 months, it hasn't eaten anything. No water, no food, nothing crosses its lips. And it's been sleeping. It doesn't urinate the entire 6 months. It doesn't defecate the entire 6 months. And then wakes up and goes, I'm hungry as a bear, and goes out and starts eating meat, essentially. Carrion, it's called, which is like dead animals, and then fish, and whatever it can find, right? So the bear starts eating all these animals and fish and stuff, and is healthy and strong and keeps the muscle mass up and all that. But then later on in the summer, the bear starts eating berries, a lot of berries, like 100,000 berries a day, and it will gain pounds every day. And so in a matter of only a few months, couple of months, the bear will gain 100 to 150 pounds in just a few months. And so, and as it's eating these berries, the berries contain what? Glucose, fructose, sugar, right? They're tasty, they're sweet. Doesn't go out, bear's not going out for fish or anything. It's just like, I got all these berries, I love them. And the berries, and then honey is really sweet, right? So the bear eats honey. What happens is the bear gets insulin resistance. And in the process of that, also gets fatty liver disease, visceral obesity, and gains a whole bunch of weight. But there's one other thing that happens. This insulin going way up, causing insulin resistance, makes the bear very lethargic and doesn't have any energy. So can't go hunting anymore. And pretty soon the bear gets really tired. The berries are going away, and the bear crawls into its den and goes to sleep for 6 months. And during those 6 months, guess what happens? It burns fat. And as it burns fat, insulin resistance goes down, visceral obesity goes away, fatty liver gets all used up, and the bear comes out after 6 months of fasting, healthy and strong. So that's the story of the bear. Now, if you have type 2 diabetes, you're just like a bear. You've been eating berries, fructose, glucose, sucrose, all those sugars you've been eating for, probably years, right? have given you insulin resistance, visceral obesity, fatty liver disease. You've gained 150 pounds. Well, probably not 100. I hope not 150. But you've gained weight. You put on fat. Why? Because insulin tells your body, don't burn fat for energy. Store, store, store. So you're storing fat. You can't burn it for energy. You have less energy. So you're going, why am I tired all the time? Why am I gaining weight? I'm not eating anything and I'm gaining weight. I'm not eating 100,000 berries a day. I'm only eating 10 or 20 of them. Well, that still creates the insulin resistance. So that's the issue. And so what we do in the Diabetes Solution Kit, we give you a way out. And that is, you don't have to go and fast for 6 months. You don't have to do that. Go to sleep and stay in bed for 6 months. Instead, you can start burning fat. And the way we do that is by taking all of the carbohydrates out of your diet. And the purpose of that is so that you don't make insulin. The carbohydrates aren't the problem. The insulin is the problem. And I want to emphasize that because that's what we're talking about today with artificial sweeteners. Artificial sweeteners, many of them, most of them, when you have the taste of sweet on your tongue, there's a signal that's sent to your pancreas to go, oh, we have sugar coming in, make more insulin. So then you have all this extra insulin. And what does the extra insulin do? It says, don't burn fat. Nope. Just don't burn any fat, store all the fat. So every time you eat something that tastes sweet, almost every time, you gain fat easily. And so that's counterproductive to what you want to do if you have type 2 diabetes. You want to do what the bear does and burn fat. As you're burning fat, your insulin levels go down and you'll use up all the visceral obesity and your fatty liver will go away. And then you'll have more energy because you'll be able to burn fat. Do you know the body burns 60% of its calories are fat and 40% are sugar? So that's more fat than sugar is generally burned. And so if you have insulin resistance and you're burning less fat, guess what? You have less energy. And that's exactly what happens. And that's what happens to the bear. It doesn't just happen to human beings. This is like everywhere. Same exact thing is going on every single day in a hummingbird. Hummingbird is going around, will eat twice its weight in sugar every day. Twice its weight. So how much does the hummingbird weigh? Not very much, but that's a whole lot of sugar. You eat twice your weight in sugar every day. Do you know the average American eats his weight in sugar a year? That's average. So you average out the amount of sugar, including high fructose corn syrup and honey and all that stuff. It amounts to about your weight in sugar on an annual basis. But the hummingbird eats double its weight every day, gets fatty liver disease, gets visceral obesity, and puts on a whole bunch of fat, and then goes and hibernates for hours and burns it off because it has a very high metabolism and has to go out the next day and eat a bunch more sugar again and do it all over again. So we give you the same thing. You don't have to fast like hummingbirds and bears, but you still need to burn fat. So if you're eating artificial sweeteners and you're making insulin, you may not burn fat. So somebody asked about allulose, and allulose is a very interesting, different kind of a sugar. It's a natural sugar, and it's found in fruits and vegetables in small amounts. It's not a big one, but it tastes a lot like sugar. It has sort of the richer flavor of sugar as opposed to the saccharin sweet, super sweet, like stevia is like 300 times sweeter than sugar. Allulose is about 2/3, like 1/3 less sweet than sugar. So it's actually like 70. They actually do taste tests. They tell people, okay, this compared to that, this compared to that, this compared to that, and they give it a percentage of sweetness. So fructose is the super sweet natural sugar, but saccharin is the original one, but stevia is like 100 times sweeter than that. So it's that means a very tiny amount of it will give you the same sweetness as a gram of fructose or whatever. So all of these sweet things are a problem, but maybe allulose is not. The research is kind of coming up to that allulose is something you can actually use. It's excreted naturally by the body. It doesn't build up any toxins or anything like that. Like fructose is a low carb sweetener. It's actually it's burned more like fat. So they call it a low glycemic index because it doesn't raise your glucose levels in your sugar. So they'll tell you that. They'll tell diabetics, oh, you can eat fructose. But fructose has a lot of toxicity. It goes into the liver, and that's where people get fatty liver. So high fructose is not good for you. It'll cause you to make uric acid, so you get gout. Fructose can be toxic. It seems like allulose is actually a little better. And so I was actually talking to Joe the other day about using allulose in making a drink, an energy drink that is actually good for you. So we're in the process of looking at that. Anyway, so allulose, not a bad choice if you have something sweet. Whereas stevia, maybe, I don't, there's some research on that. It's conflicting. Some of them show that it makes insulin go up, and some of them show that it doesn't. So there must be other things involved in that, and I don't know how to ferret that out. But clearly, most of the other ones, like saccharin and stevia, and what is that? What is the one that? Anyway, the ones that they use in the Diet Coke and all of that, those aspartame, those clearly cause insulin production, and so they prevent you from burning fat for energy. So be careful with that. You know, an easy way to do it is when you're on the ketogenic diet. If you're on phase 1 of the program in the book, you got the book, you're doing the book, you're doing phase 1, measure your ketones. And then if you eat something that's sweet, like that say has aspartame in it or something, keep measuring your ketones and see if those ketones don't drop off. Because if your insulin goes up, it'll stop you from burning fat. And then you'll take proteins and make sugar. And you don't want that. That's what those Diet Cokes or diet sodas do.
All right. Someone had asked about Truvia, which I think Truvia is probably like stevia. Is that right?
Yeah, it's a mixture. It's a mixture of stevia with I don't know what the other. It's alcohol sugar, I think.
Oh, okay.
Yeah, there's a lot of alcohol sugars, and those affect your bacteria in your intestines a lot. Small amounts of them aren't a big deal. Things like sorbitol, but erythritol, xylitol, those are okay. Yeah.
Kevin had said, how do you measure ketones again?
Okay. The simplest way is to go to any pharmacy and get keto sticks. Keto sticks they're in the diabetes section, and they're just a little tube. They got about 50 sticks in them. You pee on them in the morning, and they should turn purple. Purple means you are making ketones. You're burning fat. If it's pink, then you're not.
Joe asks, what about sucralose?
Yeah, sucralose is actually probably a little better. A lot of people don't tolerate a lot of it because it can cause diarrhea. But in smaller amounts, it seems to be okay. But it may increase insulin. And so that's where, if you're testing for your ketone levels, if you eat something sweet and your ketone levels drop down, because people have asked me that. I swear I'm staying on the diet. I haven't had any sugar, and my ketones went away. So what happens then, if you eat sweet things while you're on a ketogenic diet, it'll stop you from burning fat because insulin will go up. It'll stop you from burning fat, and then your glucagon will go up, and your liver will have to take protein out of your muscles and make it into sugar, glucose, so that you can burn glucose because you can't burn fat. So it's not a good idea.
All right. Let's see. I just want to make sure I'm not missing anything else. Monk fruit. Did we talk about monk fruit?
We did not talk about monk fruit. Monk fruit sweetener is it's an artificial sweetener. It's a sugar alcohol, and it's okay. People tolerate it pretty well, but again, the same issue might come with monk fruit. Is it has the potential to make more insulin. Another one that we didn't talk about is honey. Honey is half fructose and half glucose. It's super sweet. It's good for you in all other ways, but it definitely causes a quick rise in insulin levels. And so it'll increase insulin. And the other one is agave nectar. Agave nectar can be as much as 90% fructose, which means it's super sweet because fructose is sweeter than glucose. And so it can cause like fatty liver, and it definitely causes a rise in insulin.
Wow.
What about aspartame or
Aspartame.
Yeah.
Yeah, aspartame is another one that's made out of amino acids, but it still causes a rise in blood insulin levels and blocks you from using fat for energy. So the key to this is not so much the sugar or the sweetness or anything. It's do you make insulin? And it seems like some people with the taste of sweet get a lot of insulin production, and other people with the taste of sweet don't get a lot of insulin production. So people are kind of different in how they respond to the sweet taste.
what
I love
about,
this. Go ahead.
sorry, other alternatives like coconut sugar and maple sugar? Those are often
Almost
touted as safe.
Yeah, almost all of them are sucrose. So maple sugar is sucrose, coconut sugar is sucrose, and that means it's glucose with fructose. And date sugar is also sucrose. So those sugars, they're great sugars otherwise. There's nothing wrong with them particularly. But if you're trying to use fat for energy and get insulin sensitivity in your body, it's not going to be good to use those sugars. Somebody asked about maltodextrose too. Which is another form of glucose. It's maltose, which I love maltose. It's malted milk, malted things. Maltose just has a rich flavor that I really love. I stay away from it, but it's really tasty to me. But that maltodextrose is great, but it causes insulin to go up, so it's still not good.
Do you know the number one thing that I cannot stand in candy would be like Whoppers, malted milk.
Oh my gosh, I love those.
Or malts. Like,
Yeah.
Mulch.
I'll do a shake, but a malt, I
Yum.
can't do it. Oh,
Yeah.
that's so funny.
That's interesting.
I know. It's not normal, but okay, lots of questions are coming into the Q&A, so I feel like I better start digging into some of these. I know somebody asked. Oh, well, let's answer this. So Deborah had said while pregnant, keto sticks came out brown. Why? Proteins.
Wow.
The doctor was not concerned.
Keto sticks came out brown. Well, that would be like on the purple range, right? That's the in between. Yeah, I wouldn't be concerned about that either. That means you're burning fat for energy, at least somewhat. Yeah.
I like this question. Can a diabetic eat sweet mangoes?
No, mangoes is not a good idea. Can you? Of course you can, but it will probably release a lot of insulin and prevent you from getting insulin sensitivity. So if you're looking for insulin sensitivity, mangoes are not a good choice.
There's a really good story here from R, and it says, I went off of diet soda and substituted Truvia in decaf tea. Lost 45 pounds in 3 months, but could not get blood sugar under control. Switched to 100% water and started lowering blood sugar until retinal surgery drove it up. But still on water, and fasting blood sugar is running between 92 and 106. Still working on it.
Wow, good work. See, okay, excellent example. So you have the Truvia, which is it's a stevia and it's super sweet. And you know what? Lost weight because there's not a lot of calories there, right? But the insulin just didn't go down, and the blood sugar is not, working well. And then going on just water changed everything. So yeah, that's a great example of just what we were talking about.
I love this. This is good. You can tell Devinder has been on the webinar a few times because someone, we're asking about fruit. So now Dr. Saunders has told us we can't do all these sweeteners. So now we're going to ask you about all the fruits because we're looking for sweet in our life. Isn't that funny? Though we do like that. But Devinder said, fruit is considered healthy, but all fruits cause high blood sugar for me. And um, that's true. You may find that for yourself as well. And so that's why we talk about it. I think in our diabetes solution kit, we do mention some berries that are lower on the glycemic index, which would be what? Blackberries, raspberries, those kind of things. Do you feel like those are better alternatives, Dr. Saunders?
Remember the bear. The bear gets diabetes, insulin resistance, fatty liver, gains 150 pounds on berries.
Yeah.
That's what the bear eats to gain weight. 150 pounds in a few months just eating berries. So, eating a lot of them. Anyway, so the point is exactly what Devinder said. The fruit, it's a problem. So it's best to avoid that while you're trying to get insulin sensitivity.
Yeah. Okay. I'm going to dig into some of these questions here. Just going to start at the top. Beverly says, in my understanding, all sweeteners are carcinogenic. I know from personal experience, you can train yourself to enjoy almost everything without any sweetener.
You know what? Thank you, Beverly. As far as the carcinogenic goes, that the stimulation of the sweeteners of the adrenal glands do contribute to the inability to get rid of cancer. So we all make cancers, but our immune system gets rid of it. But when we have high levels of these stress hormones, it suppresses the immune response so that you don't get rid of cancer as well. So that's a point. That's something to consider. And so people who have type 2 diabetes do have a much higher cancer risk than people who don't have type 2 diabetes, for example. And then that other part about training yourself to enjoy almost anything without sugar, I got to tell you, and I've told you guys this before, that I am one of those addicted to sugar. Like when I was a kid, my mom did not have sugar around the house. We didn't have ice cream in the freezer. We didn't have candy. And she would get mad if the teacher would bring donuts to church, kind of thing. Don't give my kids that crap kind of stuff. So I was like, if I saw candy on a hot day melting into the sidewalk, I would scrape it up and eat it, half-eaten candy or something like that. I was like, I like sugar. So I had Skittles all the time. I was eating Skittles. My teeth were getting really bad, and the dentist said, "You got to stop that." This was a long time ago. So I started having raisins, and he's like, "Raisins aren't any better. They're just little bags of sugar." So then I started having like almonds and carrots as snacks. And you know what? I can taste the difference between each almond has a different flavor, a different sweetness. And even the little baby carrots, I can taste the difference in them. Just minor differences. It's kind of interesting how sweet they are now that I don't eat sweets.
Yeah.
Good
What do
point.
you guys do? What are some things that have helped you? I know, because some of you are commenting about, Beverly is saying, we can do this. Somebody else mentioned they gave up the sweetener in their decaf coffee. What did you find really helped you? What maybe it was a mind thing or, oh, Rayanne says, I seem to crave salt now. Interesting.
Interesting. Yeah,
Okay.
that makes sense.
Okay. So yeah, let us know. Um, It is kind of interesting. One thing, and I mentioned this to someone the other day, a long time ago, I had read that oftentimes if you crave chocolate, you may have some magnesium deficiencies. And, whether that was true or not, I implemented it. I do not eat nearly as much chocolate as I used to. And so there could be some of that. We could crave some of the things that we may be deficient in. So maybe look into that a little bit too. Okay, Anonymous says a friend has recurring UTIs. Antibiotics don't seem to help. What do I do?
Okay, for a friend, right? Okay, so that's UTI is urinary tract infection. So urinary infections, chronic urinary infections are not that uncommon. It's something that can happen. and understanding that the urinary system is exposed to the outside world, right? You have a urethra that you pee out of, and then bacteria, that's an open place where bacteria can get in. So that's one thing. So what do you do about that? And that's a good question. So you don't say if your friend's male or female, because that does make a difference. Women that get chronic urinary tract infections, especially after they've been through menopause, are often helped dramatically by replacing their hormones. So you can add an estrogen, for example, supplement, and then they will stop getting urinary tract infections. That's one possibility. For other people, I don't know if it's a male, for example, then you got to find out why, because that's abnormal and that's not usual. And antibiotics aren't helping, then there's a reason. Is there an infected stone, or is there some other anatomical abnormality causing it? So then they need a CT urogram, it's called. It's where they can see the urinary system. They put a dye, a contrast agent in there, and then it goes through the kidneys and they can see the urinary system. So finding out why, because there's a reason, and if you don't know why, then you don't know what you're treating.
Sid says, is visceral fat local to just the belly area?
Yeah, as a matter of fact, it is. The viscera refers to the intestines in the abdominal area. So liver, kidneys, spleen, pancreas, and they all have a lot of fat around them, and everybody has that. But the more fat you build around them, the more your belly pushes out, and that's the visceral obesity.
Christine says, I don't have type 2 diabetes, but not saying I'm not possibly prone, but I need to lose weight and simply do better with tracking and accountable. And Weight Watchers offers that, although I don't agree 100% with their guidelines, but thought I could modify. But tempting when they say all fruits are 0 points to load up on these. Comments?
Okay,
Wow.
let's comment on that. You don't have diabetes. Okay, so maybe insulin resistance is not your issue. So loading up on fruits, I don't know why they would have 0, but yeah. The idea is to avoid anything that's like processed, any foods that are have added sugars in them, for example, that kind of thing, and instead have fruits. So Weight Watchers is offering you have this choice, you have that choice, and we're going to give you 0 points for that because we want you to choose that, the fruit, over something that if you want something sweet like chocolate or something like that. So yeah, I'm going to have some strawberries instead of chocolate. Okay, good idea. So that's the purpose for that, and that's okay. So those are my comments, and that may not be an issue for you if you don't have insulin resistance. That might not be a problem.
I'm going to quick share this because Joe sent this.
Oh
Here's a bear with 100,000 blueberries.
my gosh. And that's a daily dose.
Wow,
That's
that is
crazy.
hilarious. Love it.
That's
Okay.
why they gain 150 pounds.
Jeepers. Yep. That makes sense. Okay. All right, back into some of these questions here. Good question here from Elaine. What happens if you don't have any excess fat?
Okay, if you don't have any excess fat, then you probably don't have a sugar problem. If you do, and you don't have any excess fat, that means you don't make enough insulin, or you have insulin insensitivity, which is usually a genetic problem, an entirely different problem. So if you're having trouble maintaining weight, or if your blood sugar goes up when you eat, you need to test your pancreas. So you look at insulin level, C-peptide, and then hemoglobin A1C for long term, and then of course the glucose. So look at those four things. And if that doesn't clarify it, if you like have some insulin, then the next step is to do a glucose tolerance test, where you test glucose and insulin. You after a 100-gram glucose drink, have you measured the glucose and insulin before you take the drink, and then every hour after for 3 hours to see what the glucose is doing and what the insulin is doing. Dead air.
I think we talked about xylitol already, right?
Xylitol. Well, sorta. We were
You
talking about
mentioned it briefly.
the sugar alcohols, yeah, and they're sweet, and they can cause other problems, like with your bacteria in your intestines. So using them occasionally isn't a big issue, but if you use them frequently, that could create problems.
Okay. Christine said I use organic stevia. Not a lot of it, but I do use it. I have weaned myself off coffee creamer though, so almost black coffee.
Yeah. So that's one of those things you can test to find out. So I'm giving you an idea of people that come to me and say, I'm doing everything right and it's not working. Why not? Um, these are the things to look at. Oh, if you're using stevia, that could be your issue, because that might be stimulating insulin production. And now you can't burn fat, so you're not getting ketones in the diet. And I have a lot of people that, they're testing the ketones and they're going, I swear I'm just eating fat and nothing else. Oh, I do put stevia in my coffee. Okay, take out the stevia. I had one woman who, that's what we actually did. That was the only source of sweet that she had. So she took the stevia out of her coffee. She said, I hate black coffee. So she quit drinking coffee altogether. And she started making ketones. So go figure.
Sib says I eat a raw beet every day, blended in my green drink. What type of sugar is in beets?
Sucrose. Yeah. And I don't know, a raw beet. I'm not aware of how much sucrose it has in it. But yeah, and there's also some starches that will be made into glucose.
Interesting. Okay. Let me see. Someone said, is there a transcript to the Zoom? If you watch it on YouTube, it will transcribe it for you.
Roseanne, Ray Ann says, get yourself a Dexcom sensor and test what foods you need to avoid and what it does to you. That's what worked for me.
Yeah, that is so fun. You guys, everybody should get a Dexcom sensor. This little button that you put on, and then you're on your phone and you can see the graphs, and it goes and you go, uh-oh, what did I do there? Oh, that's where I ate that, whatever. And you can see what raises your blood sugar and what to avoid. They're great.
Beverly said sucralose gave my daughter bad headaches. I have heard that before.
Yes, I have too.
Shirley says, isn't it better to use cane sugar sparingly or none at all rather than those artificial stuff?
Yeah, none at all is better than the artificial stuff. Cane sugar, that's like, people are buying sodas from Mexico because they actually use real cane sugar and aren't using high fructose corn syrup. So that's become a thing. Like you can go to stores and you can see the Mexican sodas because that's where you get cane sugar. So is it better? In some ways, it's better because you have less fructose, but it's still sugar, right? It's still, the bears are eating very natural berries. There's nothing unnatural about eating berries and gaining 150 pounds in 3 months.
All right. Oh, this is interesting. I just saw this comment come through that said sucralose makes part of my face numb.
Oh, I wonder why that would be. That's interesting. That's quite a reaction.
Okay, question for Joe and Dr. Saunders. Are you planning on adding allulose to fiber greens instead of stevia?
Oh, you know what? I don't know.
Okay.
There are things that you don't think about when you're, making supplements and something that somebody has to have a taste tester, and they go through the taste test, and if it doesn't pass taste test, then they go, no, you're not going to sell this. It's not going to work. I actually was working with somebody, SOS powder, that it was great. It was like the best supplement ever. I recommended it to everybody, all my patients recommended it. And he stopped making it because they couldn't pass the taste test, and nobody would make it for them. So as long as it was as long as he was paying for it, to have it made in the testing phase, that was fine. But they wouldn't mass produce it if it didn't pass the taste test. So it's kind of weird the way things work. But yeah, allulose would be a good choice for fiber greens.
Yeah.
I think one issue with it is it's potentially not, you can't sell it in Europe or some countries elsewhere, allulose for some reason. So
Huh.
that might be a problem. Yeah.
Interesting.
Hmm.
Okay. Richard says, would getting a continuous glucose monitor be worthwhile? I've lost 40 pounds, but my blood sugar is staying at average 114 to 116. I don't want to stab myself 3 to 4 times a day.
Oh yeah, then totally get a continuous glucose monitor. They're a lot of fun. Yeah, you'll really enjoy that, and not having to stab yourself 3 to 4 times a day.
All right. Judy had said, what about Atkins products and the Atkins diet?
Okay, so the Atkins diet is very similar, actually. If you've read the book, the Atkins Diet Revolution, and our book on how to reverse type 2 diabetes, the Diabetes Solution Kit, you will see that there's a lot of similarities there. We add in a lot more vegetables because I think that's important to get enough fiber in your diet. Here's the problem I have with the products is that they're processed. So just avoid any processed foods, and just, yeah, don't eat them.
All right. Oh, Anonymous said, how does salt affect diabetics?
Good question. Salt is something that is not totally benign for diabetes. In other words, if you're eating really salty things, your blood sugar will go up. So, for example, if you take a certain amount of glucose, like let's say a chip, so you're eating tortilla chips with no salt, you'll have a certain glycemic index. If you add salt, it raises the glycemic index, interestingly, because there's no added carbohydrates and no sugar, and it doesn't even taste sweet, but it does. So salt does affect diabetics. So you got to be careful of salty snacks because they will raise your blood sugar more than snacks that aren't salty.
Wow. All right. Rayanne says, can you explain how cortisol level affects blood pressure? My cortisol is the opposite of normal.
Okay, so the opposite of normal would mean there's a normal circadian rhythm where cortisol goes up in the morning and down at night. And some people, their cortisol is really low in the morning and goes up at night. That's what the opposite means. Excuse me. So cortisol raises blood pressure. It causes constriction of blood vessels and causes the blood pressure to go up. So you tend to have higher blood pressure when the cortisol is higher. So if you have opposite, then it would be likely that you would have higher blood pressure in the evening and lower in the morning if your cortisol is opposite.
Lakshmi says asymptomatic UTI caused a spike in my A1C. I got it twice within 3 months. How can I stop it?
Okay, so the asymptomatic urinary tract infection, any kind of infection, can cause a spike in the A1C because the stress from the infection makes you insulin resistant. And so when you're insulin resistant, your blood sugar goes up, and so your A1C is going to be higher. So the way to do that is you may need to check your urine periodically and find out if you're getting your urinary tract infection, or look at why you're getting urinary tract infections and fix that. So if it's a hormone imbalance, then fix that. If it's a kidney problem, fix that. If you have infected stones, fix that. Whatever's causing the urinary tract infections needs to be stopped so that you don't get that frequently. Or if there's no way, if there's, something that you don't know why or something, then you may have to test periodically. Some people take things like cranberry juice extract, and that's been shown to prevent frequent or chronic urinary tract infections. There's organic acids in the cranberry that bacteria don't like, and so they don't grow when it's around.
Someone asks, back to postmenopausal woman, antibiotics not effective. What about bacterial floral imbalance caused by use of antibiotics?
Okay, now that that's an important point, because when people take antibiotics, it changes the bacteria in their intestines. And the urinary tract infections come from intestinal bacteria. So if you have a lot of the bad bacteria, excessive amounts in your intestines, then you're more likely to get urinary tract infections as well. So in a postmenopausal woman, sometimes, and this has been shown in studies, you can take a probiotic, generally Lactobacillus bifidobacterium, probiotic, and that will prevent you from getting urinary tract infections. The urinary tract generally won't grow Lactobacillus or bifidobacterium, but the other ones like Klebsiella, when they get overgrown, then they can create urinary tract infections. So yeah, good idea. Yeah, probiotic would be a great idea.
Okay. Okay, yeah, you got that one. Rosalind is back. Dr. Saunders, since I'm working right now, it's hard to get on, but I need to understand, why is it that when I eat vegetables, after a while my blood sugar goes up? When I get a piece of meat with some kind of fat, it drops. Why is that?
Well, I don't know. Okay, so a lot of there are a lot of things that are involved in what your blood sugar is doing. And so if you're eating meat and you're not getting any carbs, then the blood sugar will tend to go down. But then if it goes too low, then you start making glucagon, and glucagon tells the liver, hey, make more sugar, glucose. So then it spits out a bunch of glucose, and your glucose goes up. So it's not really a paradoxical reaction. It's perfectly normal. Your body's working just fine the way it's supposed to. And then eating vegetables, vegetables will tend to have some carbohydrate. They have some. And so especially if you're insulin resistant, then you can see a rise in the blood sugar due to that. So it seems like that would make sense, like your body's working well.
All right. Let's see. Tom said, I started cutting carbs early January and lost over 40 pounds. My A1C dropped in 90 days from 10.4 to 6.7. So I've got more to go. I was originally on 1 milligram of Ozempic and 20 milligrams of glipizide each day. I came off the glipizide when my A1C test came back. As of about 30 days ago, I came off of Ozempic 100%, but my numbers aren't coming down. I'm worried that when my next A1C test in a couple weeks comes back, my PP is going to want me back on something. What should I do? Are there alternatives? Thanks.
Okay, so the your A1C went from 10 to 6. That's a significant drop. That's really good. That's amazing. And so there's a lot of things involved in that, you know, Ozempic by itself, along with the change in diet, the carbs. And so the numbers aren't coming down, meaning because your A1C did come down. I'm wondering if you're talking about like your blood sugar isn't coming down. So then what can I do is your question. What can I do to get the blood sugar down so that the A1C will be better so that the doctor doesn't want to put me on any other medications? That's what I'm assuming the question is. So here's what you do. Get a continuous glucose monitor, monitor it, and if whenever your blood glucose goes up, find out why. Oh, what did I do there? What did I do there? What did I do there? Because your graph is going to tell you where your blood sugar is, and it should stay between 70 and 90. And if it's after a meal, it can go up to 110, maybe 120. So and if it's going above that, then say, oh, okay, so what did I eat that contained that? So even if it's like we were talking before about vegetables, right? Even if you're eating vegetables, well, you know, squash has glucose in it. It has starches in it. And so does carrots. So your normal vegetables do have a certain amount of sugar. So they can go up with that. So looking at what's causing your blood sugar to go up is going to be really helpful. And that's where the CGM can be your best friend in this kind of a case.
Michelle says, does cheese raise glucose?
Cheese should not raise glucose. So cheese is milk that it's cultured. So what happens is the bacteria and fungus, yeast in some cases, depends on the cheese, use up the glucose, the lactose, the sugar in the milk. And in the process of doing that, they make acids that coagulate the proteins. And that's what cheese is. So there's generally not very much glucose or sugar in cheese. So it's usually very well tolerated. It's essentially protein with some organic acids and stuff in it.
Okay. Another question, does caffeine affect diabetics?
It can definitely affect diabetics. So here's the thing about caffeine. Caffeine blocks adenosine in the brain and gives you the illusion that you're not tired. But it also has the effect of increasing the adrenal hormones, the wake-up hormones. Sometimes what that does is makes you more insulin resistant. But the other thing caffeine often does, even people who drink it only in the morning, I just have 1 cup of coffee in the morning, it can affect their sleep that night. And so they may not get very much sleep, and then they make more cortisol, and then their insulin resistance goes up, and then their blood sugar goes up, and their A1C goes up. And that could all be due to caffeine. So everybody's different. Some people just break it down and use it up, and some people can drink 3 cups of espresso right before bed and go right to sleep and sleep well and have really good deep sleep and everything. And then caffeine doesn't affect them, but some people are really affected by it. So if you're one of those people, you may just have to get off caffeine.
Kimberly said, I listened to a dietitian. She stated not to be so concerned with fasting glucose due to cortisol. She stated to test glucose before a meal and 60 to 75 minutes afterward and try to stay within 30 points of spiking. What do you think of this?
I think that's not a bad idea because that's actually a real thing. The glucose spikes due to cortisol, like you're stressed or whatever, not sleeping at night, and then it spikes your blood sugar because your morning, before you even eat anything, your morning cortisol is up. Yeah, that's not by itself a problem. That's not the issue. although it does indicate some insulin resistance, but that could be due to cortisol. So, but with your diet, if you keep the glucose within 30, like if you're at 70 and it goes up to 100, well, that's okay. But if it goes up to 120, that's too much. So if you start at 90 and you go up to 120, that's okay with a meal. So if your glucose is higher to start off with, then you don't want it to spike up. Yeah, more than 30. I think that's good advice.
I think we might need to do a webinar on UTIs. We're getting a lot of questions about that, and so that might be something that
Yeah.
we do need to do. So I'm going to write that down. But Anonymous said, could fungal infestation cause chronic UTI?
Fungal, like yeast, candida. If that happens, I can't think of a case that I've had with that, but if that happens, it's probably because the immune system is really suppressed. People don't get fungal infections unless their T cell immunity is really bad. So people with historically with like HIV or they're have a genetic immune deficiency. They get yeast infections in unusual places. A baby that's born gets thrush on the tongue, that really white coating on the tongue, because their immune system is not complete. Their T cell immunity doesn't get complete until about 6 months of age. And so, but after 6 months, they should never get thrush, But so that's the yeast stuff. I imagine it could cause a chronic UTI, and that would be a thing, but that would indicate a immune dysfunction, immune deficiency of some kind.
Richard said my creatine, not creatin. Those different. Creatin, there's a creatin level,
Yeah,
but I think this is creatine. It says creatine, but it's got to be creatin.
creatinine. Yeah, it's probably supposed to be creatinine.
Creatinine. Okay. All these words, and they're the same. Okay. Anyway, Richard had said that his level is increased from 109 to 152 in 6 months. Is this something serious, and can I reduce it with diet?
Okay. The answer, is it serious? Yes. Yes. 109 is normal, 152 is high. And that's only 6 months. Now consider other things. Your creatinine can go up for other reasons. It could go up because you, I don't know, ran a marathon the day before, and you're going to have, because of all your muscle use, you're going to have extra creatinine. And so, but it still is an indication that the kidney may not be functioning well. So, number one, repeat the test when you're not overexerting yourself. And then number two, your question was, can I reverse this? Can I fix this? Generally, the kidney's not fixable, but I have had people reverse that much difference in their creatinine level, and that's partially because of their hydration status and all that. Adding fluid to their diet was helpful. But the other thing to do is to control the blood sugar really well. Find out why the kidneys are failing, and if it is kidney failure, then address the problem. So if it's insulin resistance, then address that problem. If it's uric acid excess, then address that problem. Find out why first, and then address the problem.
Okay. Okay. That is it for today. Another great webinar. Thank you, Dr. Saunders, Joe, Cheryl, everybody. We'll see you next week.
Okay.
And same time, same place. Tell a friend. I'm sorry we couldn't get through all these questions, but we'll do our best to get through as many as possible next time. So